My name is Renee Linklater. I'm the Director of Aboriginal Engagement and Outreach at the Centre for Addiction and Mental Health. Well, a sweat lodge originates in First Nations cultures, and a lot of the teachings are shared. So there's many First Nations now that use sweat lodge as part of their cultural healing processes. The sweat lodge really has different purposes and different meanings. But one of the reasons why it was really important to us to have a sweat lodge here was to be able to utilize the land, utilize the space in a way that's really culturally appropriate and really honors the traditions that have been part of this land for thousands and thousands of years. And so to bring these healing opportunities to this space, to this place, to have the protected area here, to have the privacy, to be able to come and to sit by the fire as part of our healing and recovery in those processes is just going to be so meaningful for anyone that's going to be able to experience this here. Sure, today we're celebrating the opening of our ceremony grounds here at CAMH. And this has been a vision as part of the Aboriginal service for many years. And it really, signals to us the importance of moving forward in the healthcare system and having services that are culturally relevant and culturally appropriate. Well, this will be the first fully operational sweat lodge at a hospital in Ontario. And so Aboriginal clients across the hospital will be able to access the sweat lodge. And so coming from different programs and services and not just specifically our Aboriginal services program. And we do look forward to a time where we'll be able to offer the sweat lodge and other ceremonies to those who come from other cultures. We do recognize that healing, cleansing, in different ways of touching the spirit are really relevant for many cultures. And I think that when we look at what hospital services are, it's very focused on the medical model, and the whole opportunity to start incorporating some Indigenous approaches into healing is really about creating options and creating services that are culturally appropriate and culturally relevant, and building them as part of our services completely, where we're not necessarily bringing some of our clients or needing to take them off-site to an Aboriginal agency to experience culture or ceremony, that we are able to do that here and that they're fully incorporated and integrated into our care pathways and model of service that we have here at CAMH. Well, the fire is our grandfather, and so it brings the warmth, it brings the teachings, and it brings the spirit for us. And so to have the sacred fire here, and you may notice that we actually have two fire pits. So one is attached to the sweat lodge and that we'll be using specifically for when we hold those ceremonies. And then we have a fire beside the sweat lodge, and that is going to create some really amazing treatment options for our clinical staff to be able to sit with clients. There will be times where it may be appropriate to have our group sessions out here sitting around the fire, and really recognizing that that whole being in spirit and being with fire is a human need and not necessarily just an Indigenous need. Over the months, there's been a number of us working together, working collaboratively, offering ceremonies, asking permission from the spirits, from the ancestors, from the land, from the trees, from the animals, that if we could move ahead with putting the sweat lodge here. And so our elder in Aboriginal Services, Diane Longboat, has really led us in the spiritual process and has convened and has worked and brought in cedars and has brought in the saplings to build the lodge and has brought in helpers and really convened us to walk forward, to be able to bring the sweat lodge to the place where it is in terms of having ceremony grounds that really honor our medicines. And the medicine gardens that we have right here, it's just such a wonderful opportunity to be able to have sage growing here and to be able to offer that to some of our clients, and traditional tobacco.